nurse that's reading the x-rays, are they reading the report, or are they actually looking at the films? Because I couldn't pull a nurse out on the floor right now. I could get 10 out of 10 correct on x-rays, that some of them are, I mean, all 10 are blatantly obvious.
Yeah, these were the ones who were doing some, they've had some practice reading the films.
So actually looking at them.
Mm-hmm.
Okay.
And it decreased the time.
Interesting. Do you feel comfortable doing that?
So here we don't interpret the x-rays, but we do order them. It doesn't decrease wait time, I would say so. I think the providers like it, if not promote it, in the sense that once they see the patient and engage with the patient, they already know the findings. So that interaction is twofold, where they're introducing themselves, assessing the patient, and already know what their disposition is going to be or what intervention needs to be done for them. So I do agree that definitely decreases wait times, but also expedites the patient being discharged, because it can all be done at one single encounter with the provider, and then it also allows for the patient to ask any questions or answer any questions in that. So it kind of gets the, hey, how are you doing? This is what's wrong with you. This is what we're going to do for you. Do you have any questions? And this is going to be your follow-up care. And I think that would increase patient satisfaction, because the least amount of people they're introduced to, the better it is for them to, one, retain the information and not get frustrated by multiple staff asking them the same questions.
Yeah, absolutely.
And I think along those same lines, when you talk about, having the ability to order an x-ray, some of the problems we run into, and we use a couple of our doctors as examples of why they don't want anybody ordering x-rays for them prior to them seeing the patient, is because they feel that we're ordering, somebody comes in for foot pain at the front desk, they say my foot hurts. And so they go in, and the nurse doing what they do and trying to expedite things and just do a good thing, orders a foot x-ray. But how many times did they examine that patient to determine, is that really ankle or is it foot?
Or vice versa.
Or vice versa.
Yeah.
So foot means ankle, and ankle means foot, and leg means knee. It makes it hard when you start trying to figure out what it is needs to be ordered. But it's the physical exam in the triage that makes all the difference. So the people who actually touch the patient and do the physical exam, then order the x-ray, are going to be, I think those individuals wouldn't even have a problem with us doing that, be ordering x-rays for them.
Right.
That, but we just don't.
And I feel at times, me personally, if I'm ever in doubt of what to order, I will grab the provider and say, hey, this is where they're hurting, I've palpated this or whatever. Do you want to get a tib fib and this, or do you want to get whatever? And then usually I think most of our providers and our nurses here have a very strong working relationship together, meaning that providers trust what the nurse is saying, and they'll say, yeah, if that's where they're hurting, then yeah, I get this, or no, you're good with what you ordered, and proceed from there. But yes, I do agree that, if in the event that the wrong x-ray is ordered, then that does make it's going to lengthen time and then make the patient have to go back down to x-ray and have repeat x-rays.
So you've lost the time.
Right, so then you haven't really gained anything in that sense, and the patient gets frustrated. So it does take a level of competence, which is why actually all of our triage nurses are trained and have been ER nurses for a while before they're even out in triage, much to make those decisions, which is why we have those standards in place before we stick them out there to do those x-rays on their own, to order them on their own.
That's a good topic, though. Both of them. Both topics were excellent.